Well, there are some encouraging numbers in a new state report on infant mortality. For the second year in a row, the number of infants who died before their first birthday went down.
But the report also shows the state is a long way from where it should be. NBC4's Ted Hart is live now on the north side with details behind these new numbers for us. Ted?
Yeah, well, in recent years, cities, counties, and the state have committed more and more resources to combating infant mortality in Ohio. And these latest statistics show that improvement is the result, at least in part, of knocking on doors and one-on-one contact.
Hi, Danielle.
Community health worker Kara Perry makes home visits like this as part of the city's effort to reduce infant mortality, identifying at-risk mothers-to-be, and providing support up until the baby turns 1.
This just gives us an idea of baby's milestone to see how he's doing developmentally wise.
Danilo is approaching his first birthday. He and his mom, Danielle, are getting their monthly visit from Perry, who works with the Moms and Babies First program at Columbus Public Health.
Just being consistent and being present in their life. I think that's key because we can actually show that we care about mom and we want to connect mom to the resources that she needs in the community.
Danielle says she was contacted during her second trimester and has found the visits reassuring and the information helpful.
There's resources like the WIC program and the car seat program and stuff that's been really helpful that I didn't know about before or that I was eligible for.
State officials say it's these kinds of programs that are helping to reduce the state's infant mortality rate. A new report shows a drop in the number of babies dying before their first birthday for the second year in a row. From more than 1,000 in 2016, now down to 938 in 2018. The report also shows a 12% drop in the number of black infant mortality deaths, the first decline in more than 5 years. But black infants in Ohio are still dying at more than 2.5 times the rate of white infants.
So although we're encouraged by this decrease in African American infant mortality, this indicates to us that our work is far from done.
And identified as the leading cause of infant death in Ohio is prematurity-related conditions, including low birth weight and respiratory distress. Local for you and live on the north side, Ted Hart, NBC4.
Thanks, Ted.